first of all, thank you guys so much for inviting me to speak, because I love what I do every day, and I would love to share whatever information that I have from my years of practice and help with your education and let you guys know what's really happening in the world of acupuncture and Chinese medicine beyond just this area where you study every day. So this is what I think is going on here, is that it's the Student Association that has raised money for acupuncturists in town to come and talk about what they do that might differentiate them from other practitioners, and for you guys to be able to learn more. That a good assessment of what's happening here. I think that's so amazing. When I was in school, we had to really find those practitioners ourselves and create relationships with them so we could be apprentices and work underneath them and observe in their clinics, which I think is still probably the most valuable thing that any of you could ever do for your education. But sometimes you get a speaker in, or you see an old acupuncturist on the street who you went to school with years before, and it's like, oh, that's what you're doing? We can make this medicine work in that way too. And sometimes it's really great to expand the possibilities that we have here, whether you're going to be here in Austin or go well beyond the state of Texas. There are other places beyond Texas. Sometimes we forget about that when we're here because it takes so long to get anywhere else. But so let me just tell you, I know I've spoken with a lot of you guys in the past. Some of you I know intimately or work with, and then others of you I've gotten to speak in classes that you've been in. And so, but I will just tell you a little bit about myself. I graduated from aoma in 2003, so this fall will be my 10th year of private practice. I have never had to do anything except be acupuncturist since I've been out of school. And like I said, I love what I do every day. My practice is very focused on pregnancy, and because of that, I get to see a lot of fertility, and then beyond, which is what we're talking about today, which is pediatrics. So when I was in school, I was pregnant with my daughter at the very end. I finished my national exams, I think, when I was like 6 months pregnant with her or something like that. And I was finding a really hard time for people to feel comfortable treating me. And so it was at that time that I realized I'm part of this community. I've been apprenticing with all these people for women's health, which is what my focus was more when I was a student. And I was like, people were afraid to touch me. And I was like, if I'm having such a hard time, where is this? There's a vacuum, there's something missing. And so that's sort of how my practice became so specialized in pregnancy and childbirth. And like I said, then people have babies, and they're like, there's no way I'm going to send my kid to see someone else besides you. And so then I had to do the fast track of, oh my gosh, the pediatrics that I thought I was going to do when I was 50 and my kids were all grown and I just wanted to play with some kids on the ground, I'm going to have to start to learn now. So I've had to travel all over the country. And there's a very small group of us who are really focused on pediatrics in this country, and we kind of all learn from each other different techniques, and then do a lot of practice and reading and studies on my own, things that I want to gather. And then because I have a busy practice, I also get to use, obviously, my patients to really build and see what's truly working. Dr. Fan was a huge, huge help for me post-graduate, because like I said, my clients were like, are you kidding me? I'm not going anywhere else. And it was like, whoa, I really need to be able to use some of this knowledge that I have in a way that I really wasn't taught that well when I was in school. And so through years, it's become a huge part of what I do and what I love to do every day. And in fact, I have a line of herbs that specifically are made for me, manufactured for children. So it's a huge part of what I do. And even a line of herbs that I have that are called Chi Kids that are related to all the pediatric clients that I see. So that's just a little bit of history about how pediatrics came to be part of what I do every day. So I'm assuming since y'all are here that most of you have some sort of, that's a good thing to like make sure everyone has their stuff off too. Have an idea or possible thinking about working with kids, or maybe have kids of your own and you're thinking of it more even as a personal thing. Maybe you have never even thought about using Chinese medicine with children. So I know we're all coming from different points of view. So I guess let's do a little hand raising thing. I always like to do this. This harkens me back to my days of when I was a teacher. Where are you guys in school? Are people nearing the end of their practice? This will help me a little bit when we're actually doing hands-on stuff. Are people nearing the end of their school? Let's say, raise your hand if you're going to be finished in the summer time. Just Kendra, no, 2 of you guys. Okay. And then, like, within the next year? Ish. That's kind of how it rolls, you know? Ish, it seems like, if everything goes okay. So I would say most of us are pretty far into the program. And then more, where's everyone else? Just starting. Awesome. Welcome. Halfway through. Great. Did you raise your hand and I missed it?
I'm about halfway through as well.
Okay. So in this group, because there's so few of us, I really want us to be interacting with each other. Are people interested in pediatrics, or is this more just like, I don't even know. Is there a difference between treating a kid and treating a 42-year-old man? What are people's reasons, kind of what brought them here? So I can be really specific about the way that we're going to be talking about things.
I used to be an elementary school teacher, and it was something that I felt like I did well, but I wanted to do something sort of related, but sort of different, and I think that pediatric PCM is what I want to do.
Okay.
It seems just like the build what I already can do.
Great. So some of your natural abilities or even schooling that you had in the past. Erica?
Yeah, I have a lot of background in working with kids, and I've always had an affinity for that population. And, I was telling Martin earlier, I don't have children, but I feel like maybe it's the kid in me that kind of can relate. And I've just found that, here we just don't have it's just not a part of our curriculum like it wasn't when you were here 10 years ago. So it's really, I'm here to get as much as I can get from this opportunity from you and your experience.
Great. Okay. Or are you eating? So we'll talk with you in a minute.
It's pretty clear about that. Straightforward.
She's going for pediatrics. We know that. Okay. And will you say your name too? If I don't know you, that would be really great.
Yeah, I'm Valerie. I have a kiddo, and I've been kind of navigating like how to treat him.
Yeah. So a lot of times I think it comes from our own needs. Just like I was saying, it was like, well, first I was pregnant, and I felt like I needed to give people the confidence to treat me. And then I had children, and I was already doing things with them, and clients that were then having children that were like, you must help me. How'd you get rid of her cough, And so those are great places to come from, whether it's because of your, and Erica, you too, like the work that you guys do, and you are already working with kids or having worked with kids in the past, It doesn't have to be, you don't have to be a parent. I mean, in fact, I think some of the best teachers that I've ever had no children, probably because they're not so tired like the rest of us, you know what I mean? And they have that energy. But then, just like Erica was saying, there's something inherent in some of us where we kind of want to get dirty and like on the ground, and it's like, it's all quiet and zen in the office all the time, and even when the kids are there, but you shut the door and there's a different energy that's going on in that room than in my other 2 treatment rooms, even if it's all happening at the same time. It's not the same thing. And so we also have to be able to make that switch, and that sometimes comes from having to all the time in your real life, or being trained to be able to have adult conversations and down there with the kids. So that very first page I have on there for you is to sort of keep those things in mind. Or for people who are really just here out of more curiosity, or they don't have anything else that they'd rather do than hang out with us on Friday afternoon from 2 to 5, that we can sort of go through this together. And we can talk about it. I can just read what's there. And I did want to send you home with this. You'll see, if you sort of look through what we're going to be doing, let's do that first. Some of it is really just like an outline, because you're going to jot down, or you're going to put in your computer whatever the information is that you want to take home with you. But some of it, I want to take it deeper than that, or for those of you who are really interested in this, maybe actually have something that you can look back at some point. So the first page is the part we'll go over, which is sort of what I'm referring to now, which is like, why are y'all here? And then the next page, I love books. So there's lots of different resources that I have on here. And we will definitely go through what is fabulous about each one. And then, of course, if anyone has anything that they like to add, I'm always interested in finding new resources too. But I will definitely explain to you why those are in there. And then the next page is some stuff that is more than bones of what we're really here for. Okay, how do you really even assess a child versus an adult? Okay, there are so many different things, and that's when we're going to start working together and pretend that we're kids. Okay, which for those of us who have that kid feeling inside of us, we can really be a child for a little bit. And then on the back side of that, we also have Tweenaw techniques, as well as we're going to talk a little about acupuncture with kiddos too. Tweenaw, I would say, is what I use mostly in my practice. But we're going to go over what that even means and some techniques. I mean, you guys are going to leave here with some stuff that you're going to actually be able to use. Okay? And then the last page are my beautiful handouts that I draw for the families. Here's like one of the images. And we're going to talk about ideas of and drop things. Talk about ideas of how to actually use this in practice. Okay? Does that sound like a good way for us to go? Okay, so I know it is Friday afternoon, and so I do try to be as exciting as I can be, but really a lot of it is going to be us working together, because there's nothing better than hands-on and then someone that actually knows what they're doing to kind of help you understand what I'm talking about when I'm talking about pressure, or when we're talking about assessments and things like that. I think that would be a fun way for us to end this week. Okay? So that first page, do you guys have any questions before I move on? Okay. So that first page is some of those questions that I think we all need to honestly ask ourselves. And some of them are things you might not have thought of yet because you're in halfway through school, or you have kids and you think maybe one day you might want to rub on some other people's kids. And I mean that in the best, most way. And then, or, it's your history, your background. You think, well, of course, that's what I'm going to do. So let's really think about the way that it feels, because has everyone at least observed in the student clinic, if not treating there semi-regularly? Okay. So, you have the scene, you know what the scene is when you go into the treatment room. The lights are low, there's probably pretty music on, your table's all set like this, and you might even have a place where you can talk to someone in a seated position, or maybe you're someone who likes them to go straight on the table, whatever it is. It's like that sort of quieter, zen-y space. Okay? So we're going to forget all about that, and we're going to look at these ideas and then figure out how to incorporate the feeling of the vibe of the zen-y space, but how do you create that for families to feel comfortable in there too? Okay? So the first thing is, do you like kids? I mean, that is such an honest thing. Not everyone does, and that is totally fine. Not everyone needs to be a parent. Not everyone needs to treat children. Okay? And then, do childhood disease, I should say, interest you? So what are some things when I say that? What do you guys even think I'm talking about? What are childhood things that come up that maybe we would see more often than we would see with a 38-year-old woman coming in?
Immune system things and respiratory.
Ear stuff. That's happening at my house currently as we speak. TV. So yeah, we're talking about all the way to infancy. Absolutely. Constipation. Okay.
Hyperactivity. Or the opposite.
Yeah.
Autism, spectrum disorders.
Yeah.
Thanks for speaking for me.
She's chewing. It's all good. So one of my very favorite masters that I ever studied with, Dr. Ma, he who does not treat, he treats children irregularly, but that's not his focus. He always would remind me that we can't treat anything unless we've treated the center, unless we've treated the core, whatever words you want to use to describe that. So digestive issues are almost always what we're working on with children. And every single thing you guys named goes back to that space. So in some ways, it's a little easier to treat when we know almost always that we're starting here. Okay? And then you can just think of it in a very basic way of if your metabolism is not working, then you're not going to be able to absorb anything. So no shifts and changes are going to be able to be made. It doesn't matter what herbs or fabulous nutrition, supplements, anything that you're taking. If your metabolism is not working, then we can't absorb any of those things. Okay? So yeah, childhood dis-ease, much, much different what you see on a regular basis than you will see. Mostly if your adult clients are going to be at first, well, of course, depending upon if you specialize in things or not, but just generally is going to be like, if you stay in Austin especially, allergies, pain management, right? Those are like always going to be the first couple of things that people come in for. And that's not always, in fact, pain management is very rarely what I see. That's like if I have an established relationship with the family that I would see pain management stuff. Okay?
Also, I guess kids are different from adults in that it's a little bit, you can't ask the same questions and try to you can't, what can I say, gather information in the same way.
Right, and we will, that's so true. We'll totally go through that, absolutely. So we'll talk more about that in just a minute. You're absolutely correct. So, part of what I think why kids like to come see me and why the families like to come see me is because we have fun. You don't want to have a screaming child in there. Because A, if you're like me, you have two other people on the table and this child in another room. So that would be disturbing everyone, first of all. But second of all, who wants to ever go somewhere and not enjoy it, right? And so I feel it's the same way when we're talking about preventative health, when we're talking about boosting the immune system or working on the digestive disorders, whatever's going on. It needs to be something enjoyable because it can be very playful and you will get amazing results if you keep it where the child is enjoying it. Just like you don't want to, if a client's like, ow, 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 an adult client, at every point that you put in, you're not going to just put in like 38 more points, be like, okay, I'll be back in 20 minutes, like you don't do that. So you have to set that same feeling around the children. And most children are going to feel the most comfortable if it's a little bit more fun. And that doesn't mean you have to be like super silly and like wear a crazy hat or a big clown nose. I mean, maybe you're into that, and that's fine. But you don't have to go to that extreme. What I'm saying is playful, like a little bit lighter, a little like enjoying your time. I mean, I hope that you guys have chosen to come here because you're going to enjoy what you do every day, and so we want to feel that, especially when we're with the kids and the families. And then can you be spontaneous, which I think, back to the playful. I mean, it might be like, you might not be wearing like a head, crazy head cap or something like that, but maybe you have a basket of toys. I mean, I think at the very least you would need that. Something where you can be literally letting them at least play if you're not interacting with them in that way. And then what I think is probably even a little bit more important than being playful is, can you be spontaneous? I feel if you're extremely rigid and you have expectations, then children are probably not your number one population because it couldn't be more spontaneous. You have to be willing to get on the ground. You have to be willing to do these techniques while a mom is nursing her baby. I mean, if you want to get things done and you want it to happen and everyone to be happy, then you have to be spontaneous. It's like you have to get on the ground. There's days where we don't change the sheets for like 3 people because we're like, it's like pediatric, and everyone has been on the ground or sitting in the seat, and that's just the way it is, And I do always have some kind of dress on. I'm not like someone who, it's like, but it's always going to be just fine. We just get down into it and you just have to kind of go with the flow. And sometimes that means that people aren't always happy at first when they come to see you, or they're not happy sometime in between, and you have to be able to have techniques to try to get people back to where the treatment's going to really work for them. Okay, so spontaneity, and that doesn't mean you have to be like a super spontaneous person in every aspect of your life, but to be able to be flexible.
It goes with creativity, right? That's what you mean. It goes with creativity.
Yeah, I would say absolutely. And probably people who are interested in treating kids have some sort of creativity that's part of their nature. Okay, and now this one is going to be for you to think about more in the future when you all have your treatment spaces and stuff like that. But do you have a space where you can like move? You know, do you have your biohazard container right there? Which I totally do in one of my offices, which is also my favorite office that I like to treat the kids in because it's the biggest one. And so if they bring the whole family, we all 12 of us can fit in there. So it's like the first thing we have to do is go, okay, we have to move that biohazard container. It needs to get out of here, and it takes 2 seconds, So just make sure you're always thinking. And if you're having little toddlers come in there and you know that one loves to stick their finger in everything, then you probably want to get something to cover all of your outlets. It's just really simple things that you do, and then you don't ever have to worry about that again. Okay? So creating a space that also the families feel comfortable coming in. Because if everything is like breakable in the waiting area, and when they come into your office, it's your grandmother's antique, perfume bottle that she got on her trip to Japan, 60 years ago, like at kid level, that's not going to make anyone feel comfortable. Trust me, as a parent, I would be like holding my kids. My kids are like 9.5 and 6.5, and I still would be like holding them here, So like maybe that's not the number one treatment place to bring them to. Maybe you have a second room, or you can move some of those items out of the way so no one feels stressed out about that. Okay, and I don't mean, like my rooms look exactly the same, it's just certain things have to be moved out of the way or put up into a higher spot. Okay? So those are just like things you guys probably would never really think about at first until you got a kid in there and you're like, oh, she's going right towards my open needle container. That's awesome, So we can think about it beforehand. Okay?
That perfume bottle actually really does exist.
It does, but it's up on a shelf. And so the next part, I used to not be so high, actually. See, that's what I'm saying. Don't just let me have things broken and destroyed, and I'll tell you guys about it. So
that was the old office. So
exactly. So then the next part is to make time in your schedule. And I think this couldn't be more important for you guys as beginning practitioners. Maybe when I say beginning, maybe the first 5 years of private practice. So for some of you, that's the next 9 years, really is to have that time in your schedule. It's just not that spontaneity that I'm talking about means that things don't always go according to plan. Okay, well I have 30 minutes to see them and they're for sure going to be here right on time and we're going to be able to take them right in the room and everyone's going to be perfectly happy. The mom's going to definitely tell me everything she needs to say. The kid's going to be perfectly, under control. And I'm going to have them rung up and out with the herbs explained in 30 minutes. I mean, that is what I can do. All the time I do that. But all the time it doesn't happen like that either. And so you need to really make sure that when you're setting your schedule up, that time you really have for them. And some of this is going to go into what we're going to talk about next, which is the difference with the intake with kids and the history gathering. Okay? So we need to be able to make that time for that thorough intake and history gathering. Because people, a lot of times, my clients specifically, they will bring their children to see me sometimes before they've even ever had a treatment from me. Because all their friends have talked about it, or their teacher at school, or they've heard about me through this other family, and they've never even maybe met me before. They've never, as an adult, had a treatment with me. And so we also have to establish our relationships and the trust so that I'm able to help them talk about nutrition with their children and the herbs and the different techniques. So you have to have that time. When it comes to children of all ages, what I have found works the best is after we've established when they're coming in for their treatment and the schedule, and even if they've done it online, I like to receive an email from them stating their goals of the treatment, why they're coming to see me in the first place. And this, so I guess it kind of goes 4 and 5 really go together. The goals of their treatment, what they want us to focus on, and then some history. So if it's infants, especially important to me to know about the pregnancy and the childbirth. I need to know how old they are. Because if someone's talking about colic, and then I find out that the kid's like 7 months old, that's not called colic anymore. So we have to, I also need to know age of things, of the children. And this is all, you don't know this when someone's scheduling a pediatric initial consultation online. So, we have to check back in with them. And sometimes, especially the way our program works, like they will put in the notes, they'll tell us. They'll say things like, my daughter is 3 weeks old and hasn't stopped crying, and because they're like desperate. But sometimes people will just write, I need, initial pediatric consultation. I need to know what we're kind of starting with. Are they 13? Because see, I still consider that a pediatric, and we'll be talking about that later. So, and then when we get older, more school-age kids, we don't want to waste their 20 minutes maybe of attention span that I have to treat them, talking about them. So it's not that they're not included, because they are absolutely included. And in fact, I ask the children often, how, especially after we have the relationship, how are they feeling? Has this changed? Has this shifted? And then, of course, when they're first there, that's part of the way that I establish a relationship with them. But we don't want to spend 20 minutes talking about a 6-year-old who's like, can't believe that his mom took him here and he really just wants to go to soccer practice, Or a 6-week-old baby that we might only have awake for that 35 minutes, right? So if we can gather that information confidentially from them, and I do find that email is the best, because moms and dads will sit there and type out, oh my gosh, they'll tell you everything on email. It's great. They give you the list of all the supplements that they're taking. They'll give you all of that information. And then you just will print it out and put it in the file. And then it's a good place for us to not have to talk as long. Maybe 5 minutes, maybe, and then we're talking obviously throughout the treatment too. I would say that's probably one of the biggest things that I've learned as my pediatric practice, and my practice in general has gotten busier, because there's just not, I can't really be in there with them for like a whole hour. And it's not fair to the kids. No kid needs to be there for a whole hour anyway. Okay, so that goes into number 5, which is, that also gives the space for the parents to set some kind of goal. Like, what exactly are they here for? Is it like, sure, it's the colic, but also it might be affecting their whole entire family. Like, no one's sleeping, and everyone's stressed out. And then that's also a good place for me to help when I'm thinking about what information I'm going to give them, because I don't want to overwhelm them, which you'll understand a little bit more when I tell you sort of how my style of practice. Okay? So I say setting goals. That's always good. I mean, we should do that with our adult clients too. Like, why are you here? And you might really just be here because you're curious about what acupuncture is going to do, and everyone's told you that you need to have acupuncture. But you might be here for very particular goals. And then we can keep on reflecting on that as our practice together is going on. Okay? Are we good so far? Yeah? Okay. So then the next one is, to me, and to those of us who have been teachers in the past, the most important thing, the reason why I'm here at all, obviously, but also the reason why I do acupuncture in the first place, is to educate and empower the family. To me, there's no other, it's so high up here compared to everything else that we learn how to do, but how can we give people the knowledge enough to make them feel empowered, to let them help with preventative medicine, to let them have some sort of techniques and goals to go home with and actually see how things are going to work for them. Okay? So I, 10 million years ago, which you can tell, drew these pictures, and I still use something kind of like this today. And I send my families home with Toyina techniques, and also on there, nutritional observations and movement stuff and herbs, if any of those things are important too. I do treat the 5 branches with the 5 branches of Chinese medicine. I'm not a practitioner that just does acupuncture. So to me, all 5 are important. And so, do you guys know what I mean?
You should review those.
Okay. I'm like, oh, I forget. Okay, so 5 branches of Chinese medicine: acupuncture, bodywork or traditionally acupressure, diet and nutrition. That is 1, diet/nutrition. Chinese herbs, and movement. That is traditional Chinese medicine. All 5 of those branches. So, being that I've had to sort of explain that maybe to some of you guys. Do you want me to list those again? You got it? Okay. Acupuncture, acupressure, diet, nutrition, Chinese herbs, and movement.
What do you mean by movement?
Movement was traditionally like Tai Chi,
Okay.
Qigong, but it can be what type of, movement. Now, I definitely tend more toward yoga.
Yeah.
And movement, to me, also could be any kind of meditation, breathing techniques. So how do you get the chi and the blood moving? So that is my way that I treat, which I'm sure already has become clear because I've said over and over again, I'm going to teach the parents how to do these techniques, and then I'm going to send them home with herbs and talk about nutrition. So to me, it's all of those things together that actually make the medicine work. There's amazing things that we as practitioners and only people who have studied Chinese medicine for a long time can make happen, but then there's additional things that our families can do, or patients, clients, whatever you guys want to call them, at home that make everything that much more effective. If you can really think about foods specifically for what the disease is, then we will see better shifts. If we can really use the herbs that are appropriate for this disease, and that's what you're doing between the visits, we'll see the shift so much more. Okay? And because, and this, I guess 4, 5, and 6, again, here we go, all kind of go back together. Will we have time to explain this? I would never want to rush someone off like 3 of my Chi Kids herbs that are written in Chinese pinyin and like, here's, here you go, Bian Pian, and, all these things, and like, bye, okay, just take it, just follow the directions on the side, Kendra will check you out or whatever, it's like, no way is that ever going to happen in my office. But that does happen if you don't have time built in your schedule to explain it to them, and I have seen it over and over again. When I've seen other people's practices, when I have even felt at times when I was in a rush that I was just going to like kind of push them and be like, oh, I'll send you an email, and then like have stopped myself, years ago when I was still really working on my time management stuff. You don't do that. It does such a disservice for your clients, for your practice, for Chinese medicine. Spend time explaining things to people.
How about gradually introducing the different branches, like with grown-ups in clinic when they have the first acupuncture? Often they want to have the needle. For them, Chinese medicine is acupuncture. They want to have the experience of the needle. So explaining them that another time you can include body work, and then another step might be adding herbs instead of putting everything in the first session and them and us.
So I also will tell you, with my background, and those of you who have worked with me or seen me in clinic, I come from a very simple, traditional Chinese medicine training. I went here, but I had really amazing people who I studied underneath Dr. Wu, Dr. Ma specifically. If you've ever had, which I hope at some point you will, the pleasure of working with people who have been doing this for, at the time I was staying with them, 20, 30 years already, and families, and barefoot doctor history, and it's, from what I have gathered, and with the way my brain works, and with what I've been able to do in my own practice for 10 years, which is a lot of clients that I've also seen, simplicity. And being that that's the case, I've almost always especially with my adult clients, but I would say with my kiddos too, is start with acupuncture, or in this case, probably more acupressure. And then, you know, a few nutritional suggestions and maybe herbs with kids, because it might be a couple weeks till I get to see them. But, you know, I really feel like we need to see, with just like you're saying, with the 5 branches of Chinese medicine, what it is that's actually working. I'm not a proponent of we give them 48 things, and then we slowly eliminate those 48 things to see what happens. That's just not that's not the way my brain works. That's not what I've seen with my success of my practice. It's simplicity, making sure everyone understands what the goals are, what we have set, and then we can build from there. And then that trust is there. People are going to tell you more information, and then you can go that much deeper. And that's when I think we bring in some of those other parts. Okay. So obviously, we were kind of going around the room earlier and talking about, well, what even are childhood illnesses or things we might see in the clinic? And you guys were awesome about pulling stuff out. And there's, you know, the list is extensive, but it also is kind of the same sort of things that I see over and over again, which is why I have the line of Chi Kids Herbs, because it's very easy, because we probably have these about 10 formulas that we use, cough and, you know, digestive issues, things for sleep, UTI, bladder infection type things. We have 2 different kinds of cough formulas, ear infection. So if I must say it all in Western medicine, or Western diagnosis, that's kind of what the line looks like. And we very rarely have to do more than that. I mean, those 10 are pretty close to what we see all the time. Now, the Chi Mama herbs that I also have are some of those you can be used for the children too, and some of those we'll grab. But really, we kind of tend towards these, you know, because some of those can be used for like asthma and some damp conditions that we do see with children too. But we really, it's kind of this chunk that I see. Now, I have to say, that's sort of the way my practice is on both the adult and the children's end, since I'm so focused on women's health as well. You know, it's like you come to, and 10 years of practice, you come to see what it is that people come see you for. So that can happen for everyone over time, but it also lets you see what keeps on coming up or what we're missing, because we've had to add things, obviously, over the years, too. Like, oh, wait, we don't have a good asthma one. You know, I'm telling them the old school way of doing it, and that's just not happy for anyone to take those herbs. But we'll talk about that when we get to that sort of diagnostic techniques. So you have to familiarize with typical childhood diseases, which is also why I put this resource on the back of the different books. Okay? And then, we kind of went around the room a little bit at the beginning and talking about, do you want to work on kids? Have you worked with kids? Have any of you? That's actually a really great question. Have any of you ever seen a child in the clinic? And you might be saying a child is 14, and that's fine. Kendra, you have?
I've seen, I guess, 2 in the student clinic. I saw she was probably 10, and then I saw my friend brought in her son, who was, I think, 3.5 or something at the time.
So do you mind if we ask you some questions about your experience?
Sure.
Okay. So how did you treat those kids?
Well, with the young one, definitely did Tuinon. I haven't taken pediatric Tuinon or anything, so I was under Violet Song, and she's awesome at that. So she did the routine, and basically, I watched.
Perfect.
But the same thing, she taught my friend who brought her son in how to do it at home, and I helped, kind of write it out for her. And then we did herbs. We did. He was coming in for a lot of basically moisture in his ears, inflammation. It wasn't full on ear infections necessarily. So we gave him herbs, and we gave him Pugong Ying. His diagnosis was a lot of heat. He was constipated. His tongue was red. So we gave him some powdered Pugong Ying to take for about 2 weeks, I guess, just to kind of clear that out. And then I think we gave him the children's ear formula from Golden Flower. and he actually, I mean, because I've kept up with her,
Right.
obviously.
Uh-huh.
So, and then he did get some other treatment to help with the digestive stuff he was having, the constipation, but it's been really awesome. I mean, his doctor was wanting to have him to get tubes in his ears, so it's been good.
That's great. So you have the Tui-Na experience, and then there's some of those other forms of Chinese medicine. Did you, with the 10-year-old, was that also Tui-Na, or did you do some
I
acupuncture?
did forget to say that altered diet was a big part of the younger ones.
Mhm.
I had them take out dairy out of the diet completely, sugar, and even, I think we just talked about not like going gluten-free, but just like not eating as much processed flours
Yeah.
and stuff like that. The 10-year-old, that wasn't, I only saw that patient once. I kept in touch with the mom a little bit. She had like a ton of questions, and I actually ended up kind of referring her out because I think she wanted a little bit more than we could do in the student clinic. She really wanted to follow up with medical tests. Her daughter had been diagnosed with, I think it was Hashimoto's.
Mhm.
And I couldn't remember if it was hypothyroid or Hashimoto's. I think it was Hashimoto's with hypothyroidism. We did give herbs, and I did do acupuncture on her, which was an interesting experience because she definitely did not want to have acupuncture done.
Well, we'll talk about all that too
Yeah.
when we get to the more hands-on stuff over here. Okay, so that's great. So we've at least, there's some people coming to the student clinic. Now, obviously, one of the reasons why you have the 3-year-old is because you're there. But that's what the student clinic is for, right? For you to bring people in who you know, and you have a supervisor there, and they can be supervising you and teaching you new techniques. So if you are interested in pediatrics and you have a friend or friends or nephews or, you know, anyone who wants to see what Chinese medicine's about, it's also a really good idea to bring them into the student clinic, and especially if you have a great supervisor who feels comfortable with pediatrics too, and hopefully your partner. Like I said, it's not quite as important because you'll still be the one doing the treatment, but then you can actually get a hands-on feeling of what it's like in the clinic, and it will give you a good idea where those things need to be moved off the shelves and stuff like that, those clinic rooms that are already, you know, set up for you guys. Anyone else seen kiddos or teenagers even?
I've seen teenagers in the swim clinic, and of course you initiated the whole thing between my, at that time, 7-year-old son, Lenny. He wasn't ready for needles yet. Meanwhile,
Right.
he is. He comes, Mommy, and you do needles on me.
Awesome.
For allergies and sleep. And my 5-year-old comes, Mommy, can you do Chinese medicine? She means rubbing her kidney. And she wants the seeds for motion sickness. She likes them.
Great.
So
Good.
I love it.
Good. I love that too. So, for those of you, Erica, do you want to add anything in with kids or things you've either seen in your practice or
Yeah, I
you know,
mean,
or in the
yeah,
student
unfortunately I haven't seen too many in the student clinics. I think I've seen a couple of teenagers. As far as kneeling goes, I've worked on, with supervision, of course, my niece and nephew out in Michigan.
with her supervisor that's out there.
Some sort of supervision.
Telecommunications.
And my experience with needles with them was actually was okay. You know, they were, you know, between 8 and 10 at the time, I think. And my one nephew still is a little like, oh, no, it's all right, Auntie. And the other one loves it, you know, so she lets me. So I think it depends on the kid, not smaller ones. I don't know. But yeah, I don't know. As far as with the nutrition stuff I'm doing, yeah, I mean, everything you're saying about the flexibility and being spontaneous and, you know, being able to work with a mom that's breastfeeding, like all those things for sure. And I've noticed working with babies that, like I learned this, like, you know, the hard way. Like went to touch the baby and the baby starts screaming and I'm like, well, let me just put myself into baby's frame of mind. And like, you know, what does this look like, you know, coming at you, a big hand. So I've just learned that, you know, you just got to talk to them and tell them what you're going to do, and that they understand that. You know, if they're 6 months old, they understand what you're saying. So you've got to like look them in the eye, and you've got to talk to them, you've got to tell them what you're going to do and where you're going to go. And when you do that, the response is completely different. And if they start to fuss, you know, it's just, you need to give them more communication, is what I've noticed.
And isn't the beauty having to speak two different languages at
Yeah.
the same time, like the parent-adult level and the kids level? I love it.
Yeah. Well, and I don't even feel like I have to even adjust it that much. It's like, you know, I'm amazed that a 6-month will understand when I say I'm going to touch your chin or go right below your chin, right here, you know, that they are understanding that.
Maybe you're just raising
They're
the pitch slightly for the kids, you know, or
Yeah.
maybe
Yeah.
different mimicry,
Yeah.
so using the same words.
Yeah.
And the level thing
think
is
that's true.
extremely important. That I would say extends well beyond just our kids, right?
Yeah.
Like if you come to someone and they're on the table and you're standing over them, feeling
Yeah.
there's a different vibe to that whole treatment that you're going to get than if you have sat with them
Quote that.
beforehand.
Yeah.
If you greet them when you bend down and look them in the eye. Yeah.
So be on that level. And those of us who've worked with kids, that's like, you know, that's one of our first things that we have to do, to be able to not be that scary, you know, big presence, you know, even those of us who aren't really that big and scary, you know. So we have to be down there with them. That's what I was saying. I wear dresses, you know, and I'm still, you're down there. That's just way at least half the time, you know, if not the whole time. So we're about like an hour into this. Do we want to take a little break and you guys stretch and eat some of your snacks, and then we'll come back in like 5 minutes? Or does that sound good? Okay. So let's try to be back here like just a little bit past 3. Had to leave early also. So I want you guys to let me know if you have any questions about any of the things that we talked about so far. Everything understandable? And then some of my favorite pediatric resources, we don't need to go over those. You all can read about that, okay? As we're sort of working, I do want to tell you a couple things. When I was studying here at aoma, shiatsu was my Asian body work that I studied. And Pamela Ferguson is my teacher, and she's amazing. If she ever comes, y'all should take something with her. And like I said, Dr. Fan, too, was really helpful, especially postgraduate, because he was like brand new here when I was finishing. So, but we got to work together more afterwards. And so a couple of Pamela's books are on there, and then really the penultimate book of Chinese pediatrics, I think, is the Chinese Pediatric Massage by Kyle Klein. Bob Flaw's book's great for herbal stuff, definitely. But when it comes to actually treating a child in clinic and learning some techniques and modalities, that Klein's book is, no one's book is quite like his. And it's something you should actually, if you're interested, buy. It's not, you cannot just check that out from the library, and it's not one of those. It's like, have it, look at it again, look at it 300 more times, and then you look at it, how do you treat, or what you should have done, you know, before that, with that child, you know, all those kinds of things. The thing that's a little bit confusing to me, personally, in that book is that he translates a lot of the meridians and the points specifically in English, and so for me, a lot of that is very confusing. And so I feel like at first, when I was first learning to use that book, I had to be like, what is I'm trying to think of like a good, there's so many funny names. He'll say things, I don't, of course, like, I don't think about things like that, but his verbiage is, you know, it's like, the water flowing, you know, the water flowing or whatever, and it's like the horse's back or whatever, and I was like, which one's the horse's back? Like, I never learned that before, you know? And so it's like a little bit of language that you have to go back to, but that's part of studying, is trying to do that translation at the same time. But that book is awesome. Like I said, anything Pamela does is great, and you can use shiatsu techniques too, because really what you're doing is Asian body work, which we were just talking about. So there's that I think it's like self-handbook, what is it called? The self-shiatsu handbook. It's a great one to like even suggest to your clients to have. And if you've ever seen it, it's real thin, it's paperback, and it's really accessible for people to actually use at home and for you to probably have in your clinic too. And that's not just for pediatric stuff. That is for people of all ages. Okay? So there's a difference with treating children and treating adults, just like we've been talking about. But one of the main differences is the assessment. Okay? And so some of these things I want us to kind of play with together. So, we don't necessarily need to go over to this zone unless we want to just get up and move around a little bit. Because you guys are sitting close enough together that we can sort of just work together to do some of these things. So when a kid comes in, there's some things that you really need to assess about that child. And some of these are things that we should be assessing the adult clients too, but sometimes we stick a little bit more with tongue and pulse and their history. But these are all good things for us to think about. So the things, I'm going to go through them quickly and then we're going to go over them. Okay? So the things that I always think we must do, especially with children coming in, is to look at their spirit, or the shen. The index finger venule. Does everyone know what I'm talking about? That first finger, there's a little vein. I think it goes away by the time you're like 6, but I think it actually goes away a little earlier from what I've noticed. And we only have it when we're that age, and that's one of our assessments. We'll go over exactly how to use that, and then a way to kind of pull it up a little bit more for as the kids as they're getting older. But I think traditionally we say 6 is as old as you are until you till you can't see it anymore. Do you think it's younger?
They say until 3 you use it for the assessment. That's what I have in mind.
Oh, it's 3?
Mm-hmm.
Okay, well, I think that you can see it a little bit, definitely then beyond that, because I still will sometimes look at it, because I always thought 6 was the number that I always use, and there's kids that are definitely 4 and 5 that you can still see that. But when we get to this stage, we're also going to talk about other ways that we want to still compare other things that we would do more traditionally with adults. Okay, temperature, and I'm not talking about with a thermometer, and then some of the things the information we can get from the parents before or after or during the treatment. We've got the urine and the stool. Okay. And then the pattern, which is more about our differentiation, which we'll go over. And then thirst. And then we definitely want to talk about the diet or nutrition of that child. Okay, so let's start with the shen, or the spirit. And this is when I kind of want you guys to either turn around, and you don't have to totally get up, like I said, unless you're just ready to do something different. Okay, so the most obvious aspect to observe in a kid is their spirit. And that is also why we don't want to have glass, jars sitting out in our biohazard containers. Because all we're noticing then is the nose that the parents are having to do to try to wrangle their kid in. That's not necessarily the personality of the kid. And it might not even really be their personality at all, except that it's this beautiful thing that they want to go check out. I mean, who doesn't want to see beautiful things and sparkly and shiny stuff, especially when you're a child and it's at your level. So we have to take those things into consideration as well. Okay? So we don't want to have any of those things that might skew our idea of what their spirit or shen is like. Okay? So we always, even if a child's coming in for colic and mom and dad are like, we haven't slept in 3 weeks, and we're all like cranky and yelling at each other, even though we love each other, we're so excited that they're here, that most of the time I hear this story, and then the baby that's coming in is like, not perfect. You know what I mean? They're just like happy. They are, nursing really well. They're completely calm, and that is going to tend to make us think that this prognosis is going to be fine. Okay, that if it's not a constant pain that this child is in, then most likely we're going to have good prognosis, and we do need to just get over this colic hump and learn some techniques, and we will be able to move on. Okay, and so we can notice that, even with an infant is what I mean, It doesn't have to be a 6-year-old, it doesn't have to be a 3-year-old, it doesn't have to be a 10-year-old. It can be even at infancy that we can see and diagnose some of those prognoses, okay? And then we're going to look at each other's eyes. So that's that's another thing like Erica referred to. She was like, when I realized I need to still look at that child in the eye, even if it's an infant, and that's a good way that you're diagnosing too. Because clear, bright eyes, we always say, good prognosis, okay? So you even will notice clear, bright eyes underneath tears. You might notice clear, bright eyes underneath a very shy child who's turning away from you, okay? And then when we do see dull eyes, typically in Chinese medicine, then we really think about not as good of prognosis, and that may require more intervention than, or really more short periods of time of our own boundaries of how long we're going to be working together until we start to see some of those changes. Okay? So I want you guys to practice looking at each other's eyes. Can be lovingly, but we want to make sure that we have the practice of what would it feel like to, if you were 6 or 5 or 3 or an infant, if someone came up to you, like Erica was saying, and they're standing over you, or coming to you kind of at a level, and just sort of look at each other, because I think these are great ways for us to do a little, evaluation of all of our kids, looking at their skin and their spirit and their eyes. Those would be, that's really, the eyes is like, the way we say we see the Shen, but sort of check each other out and look at each other and try to make it not totally uncomfortable and see what happens. And if there's anything that you notice, something that's different. And a lot of kids will not have glasses on. And that's another thing. Yeah.
I'm always looking for the spot. If it's there,
Is that like seniors have more?
Takes me back to my photo session.
I know. You're not being here on like Saturday.
Yeah.
And we
Photo
really
session, and all we do it all day. Talking about each other.
I know, I've seen one. The photographer, and then Justine was around to tell us what shots she wanted. Yeah.
And that's what I mean.
Just like looking at each other like.
you're ready for the
So
I saw the picture you have on the
some things that
website.
come up, like what does a dull eye look like? A dull eye, you guys, everyone in here has shiny eyes. They're bright. You have your what's glistening, and then you have also what's coming from the inside out. And when you see a dull eye for the first time, just like if you've ever have you guys seen like a black tongue, or something that you were like, what would that be like? How could someone have a black tongue? And then you see it and you're like, oh, that's totally how someone could have a black tongue. It's really not that weird, And it's you have to figure out if it's like ethnic, which is why they have a black tongue, if it's because of what all the indications we know about black tongue. You have to figure that out, but it's like, oh, okay, that's what black tongue looks like. And when you see the dull eyes, when you see the dull skin, you're like, oh, okay, this is different than what I usually see. Another assessment is definitely facial. Has anyone taken any of those like additional facial diagnostics? I think it's especially important with pediatrics. And again, this is something that we can't do right, like in our short period of time. There's so many amazing things that we could talk about. But facial diagnostics, just with children especially, is extremely amazing.
Is it the same? Are the zones for adults that we learned, is it the same for kids?
Yes, but you will actually see the coloring. You will actually see, like, here, you see the green. You probably have seen that with kids before. Mm-hmm. So it gives us a lot of awareness of what's happening inside. Mm-hmm. And those quick, that spontaneous, the fast, that's kind of what you got, especially if it's a nursing baby. Okay, well, she's looking at you for a second, and now she's on, the breast. Or the 2-year-old that is running around having the best time and thinks your office is awesome. But not because you're treating them at that time, but just because it's like, these new toys, you know, and oh, my mom's talking to someone else, so I could be running around safely, you know. So we have just moments, and we want to start assessing things that quickly. But the one-on-one, the face, the greeting, the hello to the kid, just as important as it is to the family, that's when we can do a lot of that, the Shen, the spirit stuff. Okay? So now I need to find out, which I will tonight when I get home, whether it's 3 years old or 13, that we stop to see the vein that's here. Okay? So we say in Chinese medicine that we cannot trust the pulses until the kids are like 7 girls and 8 for boys. And so that's why we use the vein that runs here. So like really if you look, you have a bit of it like at this part of your finger down here, right? But a baby or a child or a toddler is what we're assuming at this point, their vein goes higher up, okay, and it's more obvious, okay? So that's the IFV, that's what we use. And then and it's on the index finger, okay? And we say that that this part right here is, I'm just going to use the English translation, is the wind pass. And then the middle part is the energy pass. And the distal part of your finger is the vital pass. Okay? So we're going to pretend that we're 3 or 6 or something like that. And we're going to practice doing this. And so what you do, we're going to go over it first before y'all do it. And then we're going to start, you always start, I guess we always start distal, coming down. And that's how you're going to get the vein to start showing up. Okay? What really honestly works the best in clinic is to have a little bit of water or even maybe some alcohol. That really does help to pull the vein up. So if you have any concerns about if you're seeing it clearly or as they're getting older, we can use a little bit of alcohol or water on your finger to do the pass. Okay? So the deal is that we don't want, and this is like a whole entire class, so we're just going to go over it really quickly. We really don't want to see the vein past this first pass. So we say that the longer that the vein is, the particular color of the vein, and you guys, this is stuff that you guys can look up, and like I said, we got lots of time for you guys to learn all kinds of things, but this is our main way of diagnosing. You want the vein to not show pretty much past this, and then we want the color to look just like what you would expect a vein to look like. So we don't really want it to be really, really dark, and we don't want it to be really, really light. Those are like indicators of heat and cold and things like that. Severity of the condition is when it's more severe. You can see it all the way up to the fingertip. So just in short, the assessment of this is we use it to diagnose the severity of what's happening inside, the depth and the nature, whether it's external or internal.
You see it up there in the vital area. What do you do? What do you say? Do you say anything? What happens?
Well, that's when your assessment needs to become a lot more than just what does the vein look like. So really the only time I've ever seen it all the way up there was for a child that was having heart issues, like not getting enough oxygen. This vein was just, exactly what I expected to see. He came in, his color, and I'm not probably exaggerating, was the back of that chair, his physical color. Right? So I would have been shocked had I seen something that looked healthy really anywhere else. It was very obvious there was not enough oxygen, being moved around, infant. And so, so that's really the only time I've ever seen something that severe. And so we were obviously having very serious and candid conversations throughout the whole entire visit because a baby's skin color should not be that color, So there was much more going on. And that, just like the tongue and just like the pulse, are other ways to diagnose. It's like, again, you're like going, okay, you're really not getting enough sleep, or you're not eating well, or, it's just, you already know that, but sometimes it just is there to confirm it. And that was what the time that I've seen it before. But we do see it with external pathogens too. And so I just have never seen something that severe. And I mean, I see a lot of kids, and I really have never seen something external that was that severe. I mean, I've definitely seen it in the middle pass, but never up to the distal pass. But I think no matter what, we're talking about building trust, and so you should absolutely tell them what you see with the diagnosis. You know, whatever it is that you're seeing or noting, and then that's you figuring out how to say that without freaking someone out. So, when you guys are doing this between the two of you right now, trying to pull out the vein, which you won't be able to see, but just getting that technique down, okay, oh, sorry, going this way, you pretend that you see something, and then see what you say, because this is safe here. See how you would approach that. What do you think the words that you would use if you do see something that surprises you? Because we cannot come from a place of fear. And that's just, this is just talking to you guys as practitioners. You have to feel confidence in what you do all the time. And you really have to know that what you're doing is going to be the most beneficial, best possible treatment that you could ever give to someone. And that's in the physical way that we actually treat them with the needles or with the acupressure techniques, but it's also about how we treat them as emotional beings too. So, you know, you do have to create what Pamela Ferguson taught me very well is the chi bubble, so that you can differentiate what's happening with them is what's happening with you, and that look of fear or that frightening look is not exposed, because a lot of times things aren't as dramatic as it might feel like it is at first. Have you guys ever had anything happen so far in your treatments or clinic-wise that sort of freaked you out? That you feel comfortable saying or telling it in third person? Has anyone ever had a fainting?
Beginning of your show. That's a very interesting experience on the patients that would be.
Exactly. So, things happen. People faint. Needles get broken. Needles get left in. A lot of those, what I'm saying is not really that big of a deal compared to other things that could happen. But those are all going to happen to you in your clinic at some point if you treat enough people. And so the best thing that you can do is you have the confidence about it. And you know that you actually do have the skills to take care of all of those things. And it's the same thing when it comes to diagnosis. You don't want someone to open up their mouth and show you their tongue and you're like, oh! You know, and that might be how you feel, but you can't, that is like absolutely, you cannot do that. Like if you ever want anyone to come back, or that person for sure to come back and see you again. Because I guarantee you the only thing that they're ever going to talk about, even if you gave them the most rockin' treatment and you changed their whole entire life, is that when you opened up your mouth, that person made that sound, and that's it. Nothing else matters to them after that. And that's probably how they're going to feel about acupuncturists in general. I have clients all the time coming from other people, and they'll like give me this whole like litany of the reason why they're not going to see that person anymore, and blah blah blah. And I mean, and I live here, and I've lived here for a long time, and I lived here before I was an acupuncturist. I don't really want to hear anyone talk bad about anyone. I know these practitioners, and that they're awesome, and that their intentions are there, and whatever the situation was, that's not really I don't want to be that. But you get a lot of information, and, you know, and then when they come in, you know, sometimes it's really just what I said. Like, it was like, she made this sound, or when she was telling me about my fertility issues, this is what she said, you know, and it's like, of course, you never know how everyone's going to hear you, but you do have to always be paying attention and mindful of how they are going to hear you. And so it's the same thing goes with especially when working with kids, because the parents are there because they know that something is not right, and they feel like they don't know what else to do. They don't want to get tubes in their kid's ear. They don't want, they're going to try these other avenues first, of which maybe they've never even tried for themselves. So think about that when you guys are pretending that someone has a vein all the way to their fingertip. What would you say? How do you say that? Do you feel like you have to say something right away? So those of us who've worked with kids or have children, one of the best techniques I think we learn as parents or practitioners or teachers is take that 10 seconds to breathe, right? And we have to do that often in the clinic. Someone faints, obviously you might not have 10 seconds, but most other things you're going to have 10 seconds. And it might not literally be 10 seconds, it might be 10 nanoseconds, right? But you have to compose yourself. And so we want to make sure that maybe we just keep on looking at that vein for a minute, or 20 seconds, make sure that that's what we're seeing, and then we feel like we can talk about it.
That was actually a question I had. Can you ever manipulate this or overstimulate it and it comes up not superficially, but it's like a false positive?
Well, okay, so if you have even that as a question, you're doing it for seconds. It's going to come up and then it's going to be there. Yeah. And the other way, I know, I'm showing you guys, I'm actually doing a tween-on technique, which is why I keep on going like this, but when we're doing it as practitioners for the vein, you have to go down this way. But I don't think you can make anything happen, right? It's either there or it's not, and then you use your other diagnostic techniques to make sure that this is not going to be, that what you're seeing is really what you're seeing, right? Because a lot of us have seen tongues, right, that are maybe a little heart-shaped at the tip, and then you're like, how's your sleep? And they're like, it's totally fine. And how's your heart? You're asking all the heart questions, and nothing is coming up, and then you feel the pulse, and it really does feel fine. And you're looking at their coloring and the blood. It's sometimes, maybe their history, and you find that out later, is more right. Exactly. Right. Yeah. And so, you got to go with more than just one or two things. That's why I have a ton of things on here.
Yeah. Yeah. I was just curious if, from the interpretation, because it's when we read about that particular area of the finger, prognosis is not good, and from the ancient texts.
Right.
So how do you interpret that really in reality? Is it I have to refer out for this person to get diagnostic testing, or is it okay, that's one piece of data, let's go on to the next piece of data?
That's exactly the way I would view it.
Okay.
Is that then yes, we have 10 of these. Prognosis not good. Prognosis not good. Prognosis not good. All these things, and we're okay. Prognosis means that we can't see this person again until we know what's happening. Yeah, I would say use it as the data, the gathering. Just some of you are probably awesome at taking pulses, and then other people are really great at looking at tongue. You can look at a tongue for 30 seconds, and then your partner in clinic is how did you see what was going on in there so quickly? And then they're great at taking pulses. It's you're all going to feel comfortable with certain techniques, and not that we want to discount the other ones we use, but that just might not be your thing.
It's like a mini puzzle.
Right. That's why we have so many symptoms that show up. Okay. So temperature. This is probably the number one thing you're going to see with kids of all ages, especially interesting with infants, is temperature. Okay? Parents are going to come often and say things like, I took her temperature and she totally her temperature was normal, what it always is. And then you touch them and they feel like she should be as red as Isabel's sweater. So it's we're talking about this temperature, and I know you guys know this from studying and being in school, but really you will see it even more so with children. Their temperature can shift so much, especially in the time that you're working with them. So those are going to be telling us some of the patterns too. Temperature too may not only be to the touch, but can be seen through the coloring of the skin. And that was some of that facial diagnostics and stuff that we can go over if we get to go further. Okay? And then just like we talked about poops with, adults, it's actually the best conversation to have with parents, because especially parents who are changing diapers. This is what they talk about all the time, and they're so thrilled to have anyone talk about poops with them and want to know. You know? They're like, good, I've been telling all my friends about it, not someone actually wants to know, you know? So, of course, this is where it gets into knowledge from you, which is how do bowel movements change as babies shift? What do we expect? Is there a difference between a breastfeeding mom and one that takes formula? Do we agree in Chinese medicine that it's okay to wait 10 days to have a bowel movement, even though that might be what their Western practitioners telling them? Okay, so this is what you're going to come up with all the time. And this is going to take some studying on your own. Because I have had 2 children. I don't remember every stage of when everything switches over. I have a good idea. I'm saying, like, if I was only thinking about it from, like, a mom, you know? But it's like, it's not just about that. It's about, as a practitioner, what do I expect to see at certain stages of life? So you don't have to be a mom or a dad. It's just part of what we need to know for bowel movements. You're not going to see a bowel movement in a breastfed infant that looks anything like an adult. Okay? It's like just starting right there. We got to know that's not weird to see mustard color poops and things that are really runny. And then once you start feeding them even just the little bits of food, how that shifts. Yeah, and the change of the smell. And so some of the things that some of the parents that are especially first-time parents might be thinking is like this terrible thing is like, no, the digestion is actually working, right? So we have to start learning about that if we want this to be what we're focused on, okay? But it does come back to some of our really traditional beliefs and diagnostic techniques too. If the bowel movements have always looked a certain way and not really much else has changed, maybe no difference in food, and the mom's still eating the same thing, and then we get a different smell or a different consistency. Then, just like we use our techniques all the time, you know, with heat and cold patterns and things like that. That all comes into play, but we have to know where it should be or where it's regular, you know. And then, like, I was making it kind of a joke, but, you know, I, as a practitioner, don't think that any person, no matter if they're just born or 40, 900 years old, should wait 10 days to have a bowel movement, no matter what. So I do have to say that that is not normal to me as a practitioner from Chinese medicine. And so that's another thing you need to keep in mind when you're doing all this research and you're trying to figure out what is normal in Western, because that's really mostly where you're going to be studying a lot of this information from, is you can never forget what your point of view is, which is from traditional Chinese medicine. Your diagnostic techniques are not the same as what we use in Western medicine.
I always ask, like, I'll ask people in the start question, how are your bowel movements? And a lot of times it's fine. Yeah.
It was like hard to them.
And then how many per day? What do they look like? You can't, because people don't know. They don't realize that their bowel movements are actually pretty abnormal. You know, they're fine. I go every 3 days.
You just totally reminded me of one of the most important things about talking about poop with kids is that you cannot say bowel movement. Because it doesn't matter if they're the most well-educated 10-year-old child. My daughter would look at you and she would really have to be like, what exactly is she saying? And this child reads adult books. I mean, she would have no idea what you meant. I mean, she could get there, but it would take her a while. So always call it poop. Always speak to people on the level that they are. I mean, adult, obviously, you don't have to say that. But even when you're talking to the parents, you don't necessarily have to say, how many bowel movements does she have per day? Because, they're there and they're like, this is my baby. I want her to be perfect, So just, speak on that level. But especially with kids, I have done that multiple times and they've looked at me like I was speaking French, of which they did not know a word of French. So that's that just reminded me when you said that, is make sure we speak on a level that everyone feels comfortable. Okay? Thirst is such an important thing in Austin, Texas.
You passed over pattern.
Oh, I'm so sorry. Pattern. So that's what I'm sorry. I kind of felt like I was mushing that in, but I can differentiate that. So pattern is what I was saying was if nothing's changed. It's you're always you're still breastfeeding and no food has been changed and the mom's still eating the same food she's been eating, but now we're seeing a new pattern, you know, or that may be a new shift, but it could also be a pattern like she always had a bowel movement every third day, and now we're not seeing that anymore. Or she sleeps at 2-hour cycles. At 5 o'clock in the evening, she starts screaming. So one of the really awesome, amazing things about Chinese medicine is that because we look at everything in a very simple way, we can start looking at time does matter. What's happening at that time of day? What's the rest of the day been like? Maybe it's not the specific, like using the clock, you know, to know like what 2 hours that, you know, what meridian is overseeing that 2 hours, but maybe it's also like what's been happening for the rest of the day? Is it, wow, everything's been building up to this 5 o'clock hour? So it's like been a really hard day of no napping, no sleeping, not good feedings, and now are we at 5 o'clock because it's just everyone's done? So looking at the patterns like that. Okay. Patterns too, especially when now I'm thinking of older children, is part of like schedules and patterns are really the way that most children thrive. And so that may also have something to do with that, of what's going on, what's bringing them in. If things have all been shifted or changed, or their family just really has no structure, you know, it's all just whatever happens, happens, which theoretically is so, you know, fabulous, but it might not be the best situation for that particular child to thrive.
How far do you go in that conversation with them, Melissa? Because I'm sure you come across that like all the time, right? And
you will, because some of you will see that because part of the reason why they're coming to see you is because they have they like the alternative medicine. So I have no problem suggesting things or hearing what they say and reflecting what they say, as well as asking questions like, so when they tell me that their day is, we just wake up whenever, we just wear our pajamas, and, you know, and I was like, who doesn't want to do that? You know, first I get to that place like, oh, that would be so awesome if we all just like wore our pajamas until whenever we felt like getting out of bed. But then you're seeing like these things happening and the lack of pattern. And so then I'll say things like, so is that how it is every day? Or is that what you do on Mondays? Or is that what happens over the weekend? Oh no, this is the way it is every day. You know, I don't know. We sometimes eat breakfast, sometimes we don't. It's just like whether I, you know, have gotten out of bed or not, you know. And then we start to talk about so then more questions come up from whatever our conversation is. And then the questions, I think, is what can help us get to talking about more things, more information, right? They are more comfortable. They're like, oh, no. Because sometimes you find yourself saying something like, no, I don't have time to take a nap, you know? And you're like, who has time to take a nap? And then you walk out of that treatment and you're like, how do I not have time to take a nap? How have I not carved that out in my life? You know what I mean? So it's like sometimes the questions help us to think about what our real goals are and our goals that we have set. And so if they're coming to see me, I'm also going to be asking them to have responsibility for the treatment afterwards. And then I'm setting up also some structure for them. And if I do know that they're just like, whatever, you know, we have like 12 kids running around, I don't know what's going on, you know, then you're like, okay, when do you do this? You do this, I don't just say 2 times a day. I say, after you give her a bath, when she's still wet, this is the techniques I want you to use. And then you start to add some of those structures in and then see if that doesn't help to create some patterns. So we can do it in a really proactive way, like here's your information. But with most of my clients, I really don't say things. I'm not that specific. I mean, I give them suggestions of great times that those things could happen, but I don't really have to be that specific because they're already like, oh, it's going to be perfect. After when I'm putting her to bed and the other one's already asleep, and then in the morning because she usually wakes up earlier. You know, like they've already have that in their mind of when it's going to happen. So that's a good question. And that's just, again, playing with that particular family. And the reason, again, why we're here is because we like to treat people as individuals. And so we have to think about what everyone's life is like. It's not going to be like the last person that came in. So thirst, which is where I jumped to, because maybe it's just because I'm so thirsty that I was like, let's talk about thirst. No, I'm kidding. But it's summer in Austin. You get a lot of mixed things, especially when you hear about breastfeeding moms. Some practitioners say you should add water to the diet of a breastfeeding baby, and then other people think that is like the worst thing that anyone ever says. Since I'm not a midwife or an OB, and I do see tons of kids, I am not at liberty to say what I think about that particular thing. So again, just like kind of what Erica brought up, is it becomes a conversation that we have, because obviously it's something that they're thinking about if they're worried about it. If they're wondering, maybe if I should give her water because she does seem really thirsty or redder or hotter, or her skin is looking a certain way, then we'll talk about it. And then what really the answer is going to come from the parent and the information that they've gathered. Okay? So that's just one example. Obviously, with children, especially school-age children, we get into a different issue, which is we are not with them all day. And you bring them, you send them with a bottle of water, and often it comes back home just as full as it was when they left, and it's 105 degrees outside, and they stink, and they're sweaty, and they've obviously been having the greatest day ever, and they drank no water. So these are all things that you have to keep in mind. If the parent keeps on coming in, and they're talking about headaches that the kids have, the girl has a reoccurring bladder infection, the boy starts peeing in the bed at night, and he hasn't peed in bed since he was 3. What's really going on there? So thirst, and those are the great questions to ask. When you send him to school, what is the bottle like when he comes home? Does he drink when he's playing outside, when he comes back in? So we need to know those kinds of questions. And a lot of times, especially parents of school-age kids say, I have no idea. I don't know. He's totally out running around all day. Maybe he's drinking a bottle of water, But then I tell you, you ask them the question, they know the answer when they come back the next time. They will tell you, even if you forget to ask, or before you have your list of your things you're going to talk about, you haven't even gotten there yet, and they're like, okay, so no, he does not drink any water at all, and we're at soccer practice, and this is what I was singing, and so it's great because that's what we're here for. We're here to support the family. We don't get to go home with them. Okay. And then we get into the last part, which is one of our 5 branches of Chinese medicine, which is nutrition. Okay? So, wow, this is, again, 2,000 hours worth of class to have. But it doesn't really have to be that. I mean, I'm sort of making a joke because it's really, we know about nutrition coming from the Chinese medicinal point of view. And that doesn't mean you haven't studied other things, or maybe you haven't. It's, we do know. Your 5 branches of Chinese medicine is the way that we can treat people using nutritional medicine from the Chinese point of view, which means we're always thinking about things temperature-wise. We're always thinking about, yin-yang. We're thinking about dampness. We're thinking about bitter. I mean, we have so many levels of the way that we can use nutrition to treat. It's like you could spend your whole entire life just focus on nutritional Chinese medicine. Okay? So, which you will end up doing if you have any interest in nutrition at all anyway. So you're going to come back to that always. And it's the easiest thing, because I tell you, every single parent wants to know, what can I feed my kid? Especially when they're toddlers, because they're first eating, and they eat like toddlers, so they have one grape, and then they walk away, they're playing for 6 hours, and you're like, wait, you had 1 grape, how could you possibly have enough, And then, and so you're going to talk about things about how do you deal with food with kids? Do you leave things out? Do you put them back? Do you make them sit? And these, again, it's not what do you believe, but it's what's going to work for that family, and how are we going to get those calories into those kids that are running around and playing soccer and having so much fun that they're too busy to eat. And then, beyond that, what foods are the appropriate foods for what is going on with that child, because everyone needs to eat. And so if that is the thing that the parent can do more than anything else, more than any of the other techniques or the massage or, sorry, not massage, the acupressure that we use, we have to eat every day. So we do that at home. So give them lists of things. Give them lists of foods. And then they're going to email you back and you're going to send them a recipe, you know, and then you start collecting those things because you say, oh my gosh, how many times have I sent out that smoothie recipe, that green smoothie recipe? Everyone has that, you know. So print it out and then give it to them before they leave, you know, or the bone broth recipe. Whatever your thing is that you keep on telling people, have it there, easily accessible. Send them to that blog, send them to those things because we do want to know. And, you know, even I do this all the time, and I go through periods of time even with my kids where I'm like, wait, you just loved avocado like yesterday, and you're too big to decide today you hate avocado. You know, like what just happened, you know? But then I had to think about myself, and I go through periods of time where I had this food that I loved, and that's all I wanted to eat, and then I'm like totally repulsed by it, you know? So let's be flexible. And let's not try to add too much work to the family. One of the best books that I had when I had my daughter. Oh no! Am I gonna remember what it's called? It's like Whole Family. I don't know, something. I will. If you guys are in any way interested, just email me. I have it at my house. But it's all about her big thing. It's like she would give you a recipe, and then the bottom was like, how do you adapt this if you have a 10-month-old? How do you adapt this if you have a 4-year-old? And it was so brilliant. I don't think I ever made one thing out of the actual book because it wasn't really like my style of eating necessarily. But it was just that brilliance of, wait, why do people make different food for their kids? I mean, I always felt like that, but it was like to have it right there. And be like, this would be the adult version, but you can take those sweet potatoes out. Or this would be the, adult version, take those sweet potatoes out for your toddler, and then, use these 2 things for your kid who's 6 or whatever. It was just so brilliant because parents don't need more stuff to do. And so if you just remind them that we're all eating together and just make it a little bit simpler if you want to, it was just like so brilliant. And like I said, I'm sure the recipes were fine. I just don't remember. I think there was one really good, some stuff she did with seaweed that I liked. But there, I will definitely send along, or just with that idea in mind, of like, how do we not stress them out? It's really not fair to, make it that much harder. What we're trying to do is make it simpler. Okay? So that's how I would say the assessment more or less will go. Of course, I didn't put very simple things on there. Like, obviously, I love looking at everyone's tongue because, see, I love tongues. Like, that's my thing. And so, absolutely. I mean, there's like 8,000. I mean, we've even talked about them. Things that I could add to that assessment. But I wanted to give you also some that maybe you haven't thought about all the time, and really simple things that you'll talk about in the clinic. But tongue for sure, and you can see a tongue on everyone. No matter what, you will be able to get that tongue out. Okay? So let's take another 5-ish minute break, and then when we come back, we're actually going to do some techniques, and we'll be able to wrap up in that way. If you guys have any questions or anything, feel free. I'm just going to run to the restroom real quick, and then I'll be back, and we can, if you want to individually ask me questions, or, of course, we'll have time at the end, too. Okay?
Little PSA, public service announcement.